In today's video, we'll be discussing about facial nerve. However, these diagrams are taken from anatomy, but you can also draw it if you get a question on Bell's palsy to fetch more marks in your exam, I guess. So first of all, we will make the diagram for the lateral view of the terminal branches of facial nerve. So now I think we all remember this diagram as it was very common. So one finger, then two finger, three, 4 and 5. All right, so this one is the temporal division. This is the zygomatic. This is the buccal. Now buccal is further divided into upper and lower buccal. Then this is the marginal mandibular. And this is the cervical. Now you can include these diagrams in the pathogenesis, all right, of Bell's palsy. So let's talk about the Terego Palatine ganglion. I'm sure this diagram is might be on your tips, but I'm just practicing it and also revising it for you guys as well. So first of all, we will make the supersalivatory nucleus. All right, let me use a yellow color. So like this will go to the Terego Palatine ganglion. Okay, then we have all right. Now what we will see is one of the branches, it will go from this to this. Now this is maxillary nerve, and this is the zygomatico-maxillary nerve part. Okay, now we will see that one of them goes like this and one goes like this as well. Then down we will make the palate. Now for the palate, what you will see is there is one nerve that is giving further branches. Okay, now we will draw internal carotid artery, around which we will circle the petrosal nerve or the sympathetic plexus, cervical plexus. All right, and then we will show it going down. All right, now there is one more branch which will be coming out like this. Now let's label and understand it properly. So first of all, what we see is it comes out from the superficial, or sorry, the superior salivatory nucleus. Now this is the facial nerve. Now this one is the greater superficial petrosal nerve. Both of them is Vidian's nerve or nerve of pterygoid plexus. All right, now what is this? This is basically the deep petrosal nerve. This is sympathetic plexus around terminal carotid artery. This is T1. Okay, now this is the superficial cervical sympathetic ganglion. Now this is the greater palatine nerve. These are the lesser palatine nerve. This is the orbital branch, and these are the nasal branches. Now this is the maxillary nerve. This is the zygomatico-maxillary nerve division. This is the pterygopalatine ganglion. This is pharyngeal branch. Hmm, I think I have, yeah, I've labeled all of them. So what happens is it originates from the superior salivatory nucleus. Then this is the facial nerve. It is dividing into the greater superficial petrosal nerve. Now it goes to the Terego Palatine ganglion. From there, it gives one branch through the zygomatico-maxillary nerve, and the maxillary nerve and supplies the lacrimal gland. All right. Then there is orbital branch, nasal branch, palate में greater palatine and lesser palatine. Now this is the deep petrosal nerve. इकट्ठे they will make the Vedian's nerve or the nerve of pterygoid plexus. Now this will basically coil against the internal carotid artery, so it is basically sympathetic plexus. So this is the superficial cervical ganglion, and it will go to T1. Now this is quite easy to understand. Now how would you draw it in Bell's palsy question in the pathogenesis heading? All right, and you can also make the diagram where you tell that there is opening of the mouth and there is the overflow of tears, and then nasal and orbital is also affected, nasolabial fold is affected, also facial asymmetry, then drooling of saliva, and all such we can mention along with it. So I hope you understood what I wanted to tell you, and thanks for watching. If you like the video, do subscribe, like, and share.